man, woman, birth, death, infinity.
This is the cycle of life. We are born weak, fragile, unable to effectively satisfy our simplest needs. But with time, our bodies grow stronger, our minds become sharper, and we suddenly become autonomous human beings who have their own responsibilities, jobs, and people counting on us. Until we're not. Alzheimer's is a horrible disease. It can be a torturing experience not only to the patient, but also for his family and surroundings who keep seeing their loved one slowly extinguish. But the good news are, the prognosis of Alzheimer's is highly dependent on its early detection and start of treatment. So here are some of the most important things you need to know about Alzheimer's, so maybe you can save someone in the future. Alzheimer's is a part of a set of symptoms affecting different aspects of thinking and normal brain function called dementia. It is actually the #1 cause of dementia, making alone 80% of its causes in the United States. In a healthy person's brain, a protein called APP, believed to be a part of the process of growth and repair of neurons, gets used like all proteins in the body. So it gets chopped up, recycled, and a new protein takes its place. But in those who are destined to develop Alzheimer's disease, the part of the APP that gets chopped up is no longer soluble, and it creates a monomer called amyloid beta. These monomers, that tend to be naturally sticky, bond together and form plaques. These plaques can potentially get between the neurons, inhibiting neuron-to-neuron signaling. They can also cause inflammation in the brain by triggering the immune system and increase the risk of hemorrhage in the brain by depositing on the blood vessels. Plaques are also believed to trigger a chain of chemical reactions leading to the biotransformation of tau, a protein responsible for the fixation of microtubules. The microtubules are the structures that basically work as a trailway, transporting molecules and nutrients throughout the neuron. So the neurons slowly undergo apoptosis, cellular death, and we are left with neurofibrillary tangles. As the neurons die, the brain slowly shrinks and atrophies. As plaques and tangles continue to build up, the symptoms worsen. In the early stages, the changes may not even be detectable, but as it progresses, patients lose their short-term memory, like forgetting what they had for dinner last night. Then they progress to lose the motor skills like languages. In this stage, patients may even display some aggressive behavior or comment and do sexually inappropriate things. So sadly, this stage particularly is poorly tolerated by society. Eventually, patients will start losing their long-term memory, and the most common causes of death associated with Alzheimer's disease are pneumonia, heart disease, and strokes. When it comes to diagnosis, there was a rise in interest in the past few years for developing a new screening method for Alzheimer's disease. After all, having a patient with dementia symptoms doesn't automatically make him an Alzheimer's disease patient, and we certainly noticed that the earlier the diagnosis was made and the earlier the patient was put on treatment, the better the outcome. One of the more developed imaging methods is a PET scan with a radio tracer. We call this amyloid imaging, and it has been FDA approved in 2012 in patients who already display some symptoms of dementia because of its low predictability. Although PET scans are exclusively used in differential diagnoses of dementia, they are highly informative, as they give us the affected regions of the brain which may explain some of the patient's symptoms. For instance, amyloid deposits in the hippocampus are usually associated with amnesia, when deposits in the temporal lobes are more associated with aphasia, aka language problems. The other used imaging method in clinical practice, which was FDA approved last year, is tau imaging. Although it's not as fully as developed as amyloid imaging, but the idea is the same. A radio tracer is injected, which will ultimately bind to the tau protein, making it visible in the PET scan. Both of these techniques are great, but they have one problem.
I'm talking about this.
So a new blood-based biomarker have been suggested, and it's called p-tau 217. Although scientists are still looking into this new marker, the data so far shows that it's highly sensitive and specific for detecting Alzheimer's disease. And since it's a blood test, it's a lot cheaper. When it comes to the available treatments for Alzheimer's disease, we've been on a long losing streak in terms of clinical trials. We actually haven't seen any new FDA-approved medication for the past 20 years, until last June. The drug's name is Aducanumab, and it works by attacking the root cause of Alzheimer's. Aducanumab acts as an anti-amyloid antibody that targets aggregated forms of amyloid beta found in the brain and reduces its buildup. But with all the success and welcoming this drug received from the scientific community, you wouldn't imagine that the company responsible for manufacturing it nearly gave up in 2019 and concluded that the data they had at the time indicated that the drug was not to be found effective. Therefore, they were dropping the clinical trials before coming back in 2020 and applying for the FDA approval. Some other anti-amyloid medications that are still in clinical trials, like Aducanumab, do show some potential in slowing down the decline of cognitive function, but not nearly as effective as Aducanumab. And this is a list of the traditionally used treatments for the past few years in treating Alzheimer's disease, also known as cholinesterase inhibitors. When it comes to preventing Alzheimer's disease, the Lancet Commission reported that avoiding these risk factors may decrease the risk of developing Alzheimer's in the future by nearly 40%. The remaining 60% represent the non-modifiable risk factors such as sex, age, and genetical mutations. So please make sure to keep an eye on your elderly and live a happy and healthy life, both physically and mentally. If you made it this far into the video, please press the like button and consider subscribing.